Hello, I'm Jane Smith and I'm from the Pharmacy Department at North Bristol NHS Trust, and I'm really delighted to share our work on implementing and improving the reuse of patients' own drugs, called PODS, at North Bristol from 1992 to 2013. The work is important as in 1992 we were experiencing an increasing number of complaints from both patients and GPs as the PODS patients brought into hospital with them were taken away, not returned on discharge and subsequently destroyed. Other key drivers giving guidance include the Duthie report from 1988 that stated that PODS should not be destroyed without patients' agreement. A spoonful of sugar in 2001 reinforced this with a move to medicines management. And in 2012, Improving the Use of Medicines for Better Outcomes and Reduced Wastage, an action plan, recommends that each trust should produce a plan to actively increase the use of PODS. Access to PODS is also crucial to maximising medicines reconciliation, reducing missed doses and reducing drug wastage. The aim of the project was to implement then improve the reuse of PODS. The evolving objectives were to maximise the benefits of the reuse of PODS in meds rec, reducing missed doses and increasing savings and reducing drug wastage. The first challenge we faced was at the start, as too many wards were involved initially with poor staff engagement resulting in poor results. So for Phase 2, from 1997 to 2000, additional funding was negotiated as wards benefited from the drug savings, PODS were processed on admission, and PODS at home was introduced to reduce duplicated supply on discharge. However, results were still poor. It took Phase 3 from 2001 to 2004 with pilots of a medicines management service on selected wards and using PODS during the inpatient stay to produce improved results. So for Phase 4, from 2005 to now, the service was embedded and spread as medicines management technicians process all PODS on all wards, process savings via structured database, record KPI data and collect PODS statistics, and this produced the results we needed. As an example of the impact on patient safety, a patient brought in some metoclopramide that had been dispensed incorrectly by the patient's chemist. It was labelled as metoclopramide, but it contained propranolol. The error was highlighted to patient, and luckily she'd not taken any, but had more at home, so would check and return them to her chemist if not. Our results show that we are unique in the NHS, proving ongoing savings from reusing PODS of over £4 million over 20 years. POD usage supports our medicines reconciliation success as the best performing trust in England and Wales, as shown by QIP benchmarking data. In 2012, NBT had over 70,000 inpatient admissions and we saved over £650,000, which is approximately £10 per patient. A preliminary estimate of potential savings through extrapolating Dr. Foster data for NBT regionally and for England shows potential savings for England of approximately £85 million. We're now trying to publicise our work so that others can achieve similar results and we can all maximise the reuse of PODS. Thank you.